So as we are supposed to discuss Alex2 Allergy Explorer, it's a molecular based 300 panel test. So before getting into the details of the molecular test, we are first going to discuss the difference between what is the allergy and what is the intolerance. So there are two words which are commonly used. So allergies are the abnormal reactions of the immune system that occurs in response to otherwise harmless substances. And intolerance can mimic allergies, that is, it can look like allergies, but it does not involve the immune system. So adverse food reactions, they could be immune mediated, which is allergies, and non-immune mediated, which is the intolerance word which we are using. Right. So the immune mediated usually could be IgE mediated, which can cause acute urticaria, oral allergy syndrome. Non-IgE mediated can cause food protein induced enteropathy syndrome, celiac disease. Mixed IgE and non-IgE mediated can cause eosinophilic esophagitis, and cell mediated can cause allergic contact dermatitis, which is a skin symptoms. Non-immune mediated, which is food intolerance or intolerance, which we commonly used. It could be a metabolic, which is lactose intolerance, that is intolerance to the milk. It is because of the deficiency of enzyme lactase. And it could be a pharmacological, toxic, or other idiopathic unknown causes. So how is IgE related to allergic reactions? Basically, whenever there is an antigen which is irritant, that is an allergen, like food, pollen, animal, venom, etc. When our body misinterprets this antigen, it is exposed and it reacts and forms an IgE, which is an antibody to protect itself. So then IgE attaches to the floating mast cells or the basophils. And when next time these antigens reappear, they trigger the mast cells to release chemicals like histamine and cause allergic reaction symptoms like pruritus, which is itching, or redness, or further like cutaneous, respiratory, GI, or anaphylactic type of symptoms. So how do we distinguish it's an IgE or IgG? So IgE will always cause immediate hypersensitivity. Symptoms would be immediate, easily detectable, and more common in children. And usually if we fix the allergies and or the allergen, we can be relieved from these. They typically involve one or two foods, and then if we identify and avoid those, we can remove the hypersensitivity. So what do you need to know about the food allergies? 95% of the common allergies are the food allergies. It can cause caused by milk, egg, wheat, soy, peanuts, or fish. Food allergies are more common in children than in adults. Usually 68% of the children under the age of 5 are affected with the food allergies, and most common appear within the 2 years of the lifespan. There are few food allergies which can persist even in the adulthood, but usually they get resolved during the childhood. So about half of the individuals with food allergies will react to more than one food. This is because of the common proteins. For example, egg and milk have few common proteins. So that is the reason we always tend to get the false positive results. So this molecular test will rule out all the false positives. So there are no diagnostic tests available to predict the severity of the future reactions. So what are the risk factors for the development of food allergy? Could be family history of atopy or presence of atopic dermatitis, especially moderate to severe kind of atopic dermatitis in the children under the age of 5. What are the common allergens which can be tested? This molecular panel can test almost 295 to 300 allergen panels, out of which more than 150 are the food and related allergens. So allergens which can be tested are grass pollens, tree pollen, wheat pollen, house dust mite and storage mites, legumes which we commonly consume like chickpea, pea, peanuts, grains like barley, wheat, oats, quinoa, etc., or spices like paprika, mustard, oregano, parsley, fruits like banana, apple, cherries, mangoes, muskmelons, peaches, etc., and vegetables like carrot, onion, potato, tomato. There could be seeds, almonds, Brazil nuts, cashews, hazelnuts, fenugreek seeds, poppy seeds, pumpkin seeds, sesame seeds, common roaches like cockroaches, insect venomins, fungal spores, milk, egg, fish and seafoods, meat, pets, farm animals, and others. So why is it important? Because finding out the source of allergy is a more effective way to prevent and protect yourself against allergic reactions actively. Because allergies, of course, cause the physical damage, but the long-term allergy reaction can cause emotional stress and make it difficult to concentrate at work or school. in case of children, which could seriously affect, of course, the social life, studies, quality of life, work performance, and there could be an emotional damage to it. Allergies medication can help treat the symptoms, but it is always a symptomatic cure. Unless until we find the allergen source, we are not going to be relieved from all the symptoms. So what are the common symptoms? It could be cutaneous, that is the skin. It could be urticaria, angioedema, erythema, pruritus, atopic dermatitis. Respiratory could be cough, dyspnea, wheezing, nasal congestion, laryngeal edema. Gastrointestinal like oral pruritus, tongue swelling, nausea, abdominal pain, vomiting, diarrhea, angioedema of lips, tongue or palate could occur. And rarely tachycardia, hypotension, dizziness or fainting, that is the cardiovascular can happen. And usually a rare thing is sense of impending doom, that is feeling of death. So why do you need allergic test? If you are atopic or suffering from any of the allergic reactions such as eczema, rash, asthma, urticaria, conjunctivitis, food allergies, or you have any symptoms which we already discussed, that is one of the reasons to get tested. Or if you have a family history of allergy, or if you plan to do an allergen immunotherapy, so which is applicable to the 4th generation IgE allergy test, which is like this molecular Alex2 test, or if you need a regular screening to identify underlying allergic triggers that might be contributing to your symptoms. So when should allergy be suspected, or who needs to be tested? Any individual presenting with any of the symptoms we discussed. It could be a skin symptoms, it could be respiratory symptom, gastrointestinal symptoms, specifically which can occur within minutes or hours of ingesting food, especially in young children. And if these symptoms are followed after specific food or specific allergen on more than one occasion. Children and adults diagnosed with certain disorders like eosinophilic esophagitis, enterocolitis, enteropathy, and allergic proctocolitis. And children less than 5 years with persistent atopic dermatitis. In spite of the optimized management and topical therapy, 30 to 4% of these children will have food allergies. So you'll ask, am I suitable for IgE Alex2 allergy test? Yes. If patient is having any skin or respiratory problem, or is having any of the symptoms which we discussed, or if you identify food and environmental allergy triggers, or for the children in the developing stage who has an immature immune system, you want to identify the allergen and also to avoid the unnecessary and inefficient medication. So these are the 4 ways in which we can recognize do we need a test or not. So what is usually we evaluate if a patient is having allergic? We take a detailed history, we try to list the suspected foods or allergens, we actually check the quantity of food eliciting a reaction, is there a reproducibility of the reaction, time between exposure and reaction, clinical manifestations, and resolution of symptoms with elimination of the food or suspected allergen, treatment given and overall duration of symptoms after each exposure, any physical examination symptoms, and we focus on the suspected target organ system. It could be cutaneous, respiratory, and gastrointestinal. So how do we need to defeat allergies? By clearing out the real allergen. So for that we need to meet the 4th generation IgE Alex2 allergy test. So it's largest commercially available IgE molecular allergy panel globally so far. It's a breakthrough in a technology with an allergen panel of more than 295 relevant molecular allergen and extracts. Complemented by total IgE, we aim for 99% of coverage of all routine diagnostic tests. So it can specify the total IgE and also the specific IgE with all the common allergens. That is, for all the 300 allergens, there would be specific IgE levels and of course the total IgE levels. So it includes more than 150 common food and environmental allergens. For example, eggs, nuts, seafoods, beef, etc. For the environmental allergen, dust mites, plant pollen, animal danders, etc. Could be pet animals, could be your cattle farm animals, and it can because the allergies, of course, as we discussed, can cause more physical damage, but it can cause further emotional and damage and can reduce the quality of sleep. And in children, it can of course affect the concentration at the school and of course social life and work performance. So Alex Allergy 2 is the first in vitro multiplex allergy test. It involves allowing simultaneous measurement of total IgE and specific IgE. It's a near complete picture of each patient's sensitization status. based on the test panel composition of allergen extract and molecular allergen. It's a CCD-free allergy diagnosis for increased specificity, and it is the only system with integrated CCD antibody blocking capability. So these advantages are, it's a near complete panel covering 99% of the common allergen, and there is a simultaneous measurement of specific Ig and total Ig. And of course, it's a solid phase immunoassay. So all the extracts, they are coupled with nanotechnologies and deposited in the solid phase, and we use a microscopic array. So it's a kind of a method where we use the particle is bound allergen react with the specific Ig, and after incubation and certain procedures followed, so we can get the final results. So Alex2 supports diagnosis of allergic reaction in conjunction with other diagnostics such as amnesic, clinical history, and physical examination. In addition to identifying the sensitized allergen source, it provides a complete and high resolution molecular Ig profile at no additional cost or effort. So compared to the extract-based diagnostics alone, which were the conventional methods, this can add relevant diagnosis information on indication of specific immunotherapy if needed, risk assessment for your patient to avoid severe allergic food reactions, and molecular information about the cross-reactivity. So this is the 4th generation IgE chip. You can see on the right side, it's a small chip which has 300 allergens covered in it. So there is no subjective error. That is, we cannot pick and choose a test. Whenever we are testing a patient, we need a blood sample, and we need a serum sample basically from the blood, and we are after following certain protocols and certain test method, we are putting the sample directly on this chip, and there is a time period of 6 to 8 hours of the testing time. So usually if we receive a sample in the morning, the same day reporting is the answer to it. The practical benefits, of course, is the quantitative analysis of individual allergies on a simple test chip. The reliable technology is designed to test hundreds of allergies, and it is highly sensitive and accurate, and it actually determines the true allergies, and of course it also tells about the cross reactions. An interactive CCD, it reduces the false positive reactions. So identifying the potential risk for the development of heavy food related reactions to the presence of molecules such as spare protein, tropomyosin, LTP, other substances. So basically, why do we need to identify our true allergies, your true allergies, and of course the root cause behind? Because we can use this multiplex array technology, and it will of course help in getting to know the exact allergen which is causing all your symptoms, and we can actually rule out and of course avoid lot many other allergens which we supposedly think could be. So precisely identifying similar allergen is also important, because in conventional methods there were cross allergies. Like if a person is allergic to shrimp, it can also be allergic to mite and to the cockroach, because these have the common proteins. So this cross reactivity is ruled out in this molecular method. So it's a groundbreaking molecular test which you don't need to avoid everything. So it will actually tell you the precise protein which can be avoided, or protein with food allergen, and of course it will also tell you the details in which, if applicable, you need an immunotherapy, or you have to totally avoid that food or whatever the allergen is, or there could be any treatment option available. So why testing the whole allergen and extract is so important? Because like for example in a milk there are 12 kind of allergens which can be possible, but out of that only 3 could cause allergic reaction. So we need to rule out all those allergic allergens. So this is again how this technology is made. It's based on so many of the aspects. It's a multiplex assay. It has a microarray technology, nano technology, etc. So it, for example, it's also telling you the avoidance strategy. For example, milk has so many of proteins. Out of these 3 proteins, there is one of the protein which is heat stable, and other 2 are heat labile. Heat labile means if we boil the milk, it could be killed, and so we can take the milk. So it will actually help you in the clinical precise diagnosis. So this test is available with us at Zenith Healthcare Labs, Patiala. The TAT, that is the testing time, is 6 to 8 hours. and we need a sample of blood or serum, maximum 2 to 3 ml. It is applicable for all the pediatric patients as well as the adult patients. Any form of allergy can be tested. For further details, for the pricings, and for any further queries, feel free to call us at 854448 22350. I am Dr. Sikhagar.